Hi, this video is the art of hair transplant restoration surgery, and this is the second surgery. I'm going to show here the audience what the first before surgery and what's after the second first surgery, and then what's after the second surgery. And the first time we did it, he has a advanced hair loss pattern. So I try to give him the most natural and most mature hairline, but still we cannot be too aggressive with the first hairline because there's so much area to cover. He's a class 4-5 hair loss pattern, thin front toward the back, and there's so much area to cover, so we don't want to be too aggressive with the first one. And the second time around, when he comes in, when everything is fully grown, then I can completely feel the density in the back and lower his hairline almost like 1.5 to 2 centimeter down a little bit more, and add more depth to his hairline. And look at him, so much younger and handsome now. And you see how excellent density and volume. I'm going to show the audience what he looked like before surgery. So that's right before. Actually, and he's pretty much thin from front to the back, no hairline. And again, because of the first surgery, we cannot be aggressive because he had advanced hair loss, and we're trying to cover as much as we can and still balance. We give him a good hairline and a good density. But this is just one surgery, and look at that, the density, it looks fantastic. But you see how much younger he looks, and brought back his handsome youth and face. But now, even that, you know how perfectionist I am. It's when it comes to hairline, I want to add more depth to the hairline, so I lower the hairline at least a thumb, and I dip down a little bit more to add more depth to the hairline, and more artistry and more detail really. And you can see we came here, we lower that, we dip that down, and we brought in both sides as well. And you see the side of that one is good, but this one, the side are a lot closer. It's very subtle. If I don't point it, people don't know. But you see his handsome face come out more, and he looks quite a bit more youthful, and the hairline is perfect now. So I won't tweak the hairline anymore. But that's before surgery. This is after one surgery, and the medium tight hairline. It looks really good. But the third, not the third, but that's one surgery. And the second surgery, you see more volume, more density. That's one. But the hairline is more depth to it. Why? Because we dip it down, we add a lot more cleaning, feathering up to the hairline, and we brighten the temple a little bit more. And so now it's really completely perfectly proportional. And that's before surgery. This is with one surgery. This is with second surgery. And you see we brought in a little bit more. And you see it's natural. And that's the key word. Again, you need both an artist and a surgeon to have a perfect. This is before surgery. This is after one surgery. And it looks good. We brought in the temple quite a bit. But you can see, and this one is more volume, more density, and the temple it brought in, and the hairline is slightly lower. And again, this is when we add, absolutely add more detail to the hairline and be a perfectionist. That's what I want. But again, you came from this. You see, he came a long, long way. And you see how significant hair loss. And with first surgery, I couldn't cover everything. There's a little bit light in the back. But considering with one surgery, that looked fantastic. But now, it looks good. And you can always do more. And being how perfectionist he is, you can always can decide. But that was him, and this is where he is now, with excellent coverage, excellent density. And and you can see how I comb the hairline up. And you see how I dip down the hairline. I add quite a bit of depth to the hairline, and we lower the hairline now. It's very proportional, third and third. And good volume, good density, and how natural that is. Okay, and so this is the art of hair transplant restoration surgery after the second surgery. And you look at his density and the volume. It's excellent. Thank you.